Hello, good afternoon. Can you hear me? I think I'm muted. Hello, hello, good afternoon.
Hello. Hello,
Hi.
Professor.
Yeah, can I
Hello, how are
share
you?
my screen or not yet?
Um,
Hello.
Not yet. We are waiting for the rest of the participants to arrive. So if you can
Okay.
wait just a little,
Um,
10 minutes,
okay, I
maybe.
wait for 10 more minutes.
Thank
Should
you.
I try once to see if it works? And
Okay,
then I
okay.
stop it. I just, can you see it?
Hello, Professor. Yes,
You can see it.
yes,
Okay, great. Thank you.
yes,
I just want to show it works. So then I stop it. So
yes. Because
thank you very much.
we will start at 2:30.
Yeah,
And
so I still
okay,
have 6 minutes to go.
okay.
Thank you. Okay,
Thank you,
thank you.
Professor.
I will
Thank
wait
you.
here. Thank you.
Okay.
So Olga, thank you. Nice to meet you. Thank you,
Yes.
Olga.
Thank you.
Yeah.
Thank you.
Hello, Professor.
Yes.
Hello.
Yes.
We are asking you to put the slides in the presentation mode. You have the slideshow.
Do you
We
want
need to
me
see
to
the
share my
slideshow.
screen now?
Uh, can you please test so that we can see?
Is this okay?
Yes, and the slideshow.
I put them in a slideshow mode. Yes, I'm going to do it. Um, slideshow mode. I'm working on that.
Mm-hmm. It's in the bottom of the.
Slideshow. Oh, it works now.
Pedro.
Is this
It's okay.
correct?
Yes, it's fine. It's
It's
fine like
fine.
this.
Okay.
Thank you.
So I keep these slides because when I move it, it goes
Okay.
down. But I
Okay.
keep this one. You have no problem.
No,
And
no, it's
then
fine. It's
after
fine.
that, I can
You
start.
can leave it there. Thank you.
Okay.
Thank you.
So we still have 10 minutes, I think.
Okay.
Thank you.
So, okay. So
Hello.
shall we
Can you-
invite the speakers to the stage? Oh,
So can you hear me now?
okay, so shall we start? Good afternoon, distinguished guests, ladies and gentlemen. It's a great honor to welcome you all to this scientific session on traditional herbal medicine and biomedicine. I'm Yang Changxin from Jiangxi University of Chinese Medicine, and this afternoon session will bring together 5 experts to explore the convergence of traditional knowledge and modern scientific research, focusing on quality, efficacy, safety, and clinical application of herbal medicines. First, please welcome the first speaker. I would like to give you a brief introduction of Professor Mei Wang. Dr. Mei Wang graduated from Peking University in 1982 and obtained her PhD degree at Leiden University in 1988. She's the founder and director of the SU Biomedicine BV and a senior researcher in traditional medicine at the Noordrijn Biodiversity Center, Leiden. Representing Netherlands in the European Pharmacopoeia, she has served since 2009 as an expert at the EDQM on Chinese herbal medicine. Dr. Wang led the successful registration of 2 TCM herbal products, Diaoxin Xuekang capsule and Xiaoyao tablets, under the EU Directive 2004 and 24 EC. She has authored over 170 peer-reviewed publications, reviewed for more than 15 journals, and serves on the editorial boards of 3. As co-promoter, she has supervised 16 PhD graduates at Leiden University. Her research focuses on scientific validation and quality assurance of traditional Chinese medicine through system biology and regulatory studies. Dr. Wang also serves on the NVF board, presides over the GPTCM Research Association, and chairs the Dutch NEM ISO TC 249 Commission on TCM standards. Now, let's give the floor to Dr. Wang. Please.
So can you hear me now? Can you hear me?
Yes.
Okay. First of all, good afternoon. Thank you very much for inviting me to give my presentation at this very important conference. My special thanks to Professor Olga Silva, and because of she invited me to this conference. And as you already have seen, the title is Quality versus the Therapeutic Efficacy of Chinese Herbal Medicine. Can you hear me? It's no problem?
Yes, I can hear you, Professor Wang.
Thank you very much. So as also the leader, the chair session has already given extensive introduction of myself. I will skip the first slides. Then I immediately go to the traditional medicine. So the WHO has reported on traditional complementary medicine. They dedicate for the national policy regulating product practice and practitioners to encourage them to practice traditional medicine, which have universal health coverage by integrating Chinese medicine or in traditional medicine for the service and health care. When we look at worldwide, what's happened is in this WHO has conducted the investigation. You can see in 100 countries, of which 99 countries reported that for traditional and complementary medicines, the lack of research data. So there are also lack of functional support, financial support for research. So I'm very happy today to see this memorable conference organized in Lisbon with support from the different sources. So this is a very nice way to promote the traditional medicine. So we might come dedicated to the traditional Chinese medicine because it's based on the
Sorry, Professor Wang, I have to interrupt because we cannot see the slides. Do you have the
Oh, so that's strange. Can you see the slides now?
No.
So then it's very strange. So sorry, then in that case, I have to end the show and reshare it, I guess.
Yeah, share the
So, okay, I'm sorry. So I reshare it. So thank you for.
Yeah, it's fine. Now we can see.
You can see it now.
Yeah. We can see the slides.
But then when I put in a slideshow mode, shall I try that? Or this is already good enough?
Yeah, I think it's good enough.
Okay, so then I keep in this form instead of having the slides mode. Maybe there's some technical issues. So I continue to see that different countries, they reported have lack of research data and lack of financial support for the research on traditional and alternate complementary medicine. I think maybe Chair, can you also mute? Then it will have no echo. Chair, if it's possible. Okay, so now I continue. There will be no echo, but you still can hear me, I guess.
Yes. I can hear you and I can see you.
Yeah, because I think you are not muted, so we have very strong echo. I do not know if the audience has the echo or not.
Maybe after the presentation, the audience, I will give you several minutes to answer the questions from the audience.
Yeah, but maybe it's better you first mute yourself because otherwise it's very strong echo. You see the point. Okay, I continue my presentation about introduction of traditional Chinese medicine. So it's from the Orange of Man, but it's also based on different culture. You have Chinese and Western cultures, and you have different philosophies. And from a philosophy, you generate the philosopher science, and you have science. So traditional Chinese medicine is based on its own culture and developed into the medicine. Well, it looks like they are very much different from Western medicine. However, recent technologies since 1990s, we developed systems biology technology. This can, yeah, so we have very strong echo. So because a chair lady, if you are muted, then maybe we will have no mute. Okay, I continue anyway. So so this means the systems biology might be a good technique to introduce and to bridging the traditional and Western medicine. From this perspective, I would like to show this cartoon, which shows when in the Universal, this gentleman using his advanced technology can see what's happening in Universal, but without the warning of his wife, then he is maybe missing some important part of information. So Western medicine may be thinking it's reductionistic, while the traditional Chinese medicine is versus holistic approach. So they are not against each other. My idea is they should be combined reductionistic and holistic approach. We may see the whole universal what's happened, which will be the same technique for the healthcare. So when we combine the Western and Chinese combined reductionistic versus holistic approach, we may generate a new type of medicine which can treat the patient, improve quality of life, and to have preventive medicine. So here is the introduction of the systems biology technology approach. So you have cell, tissue, and organ. We try to measure as much as possible transcriptome, proteome, and protein and metabolite. And with this information, we can use biostatistics. We can generate biomarkers, pathways in the system. Even we can gain the system's knowledge and wisdom. From this perspective, systems biology might be a nice template for understand personalized treatment, especially bridging the traditional Chinese medicine with Western parameters, Western understanding. For here, I would like to show one of the example which we collaborate with the Chinese Academy, China Academy of Chinese Medicinal Sciences, conduct a clinic study in Xiyuan Hospital. Here you can see when Western doctors, they diagnose patient to have a stable angina pectoris, and then we ask Chinese doctors with the inclusion which were already Western doctor already approved, they are having stable angina pectoris. We ask a Chinese doctor to further segregate them into two different subgroups. One is Xu subgroup, another is Shi subgroup. So these two subtypes, we compare them with their metabolic profile in plasma, which clearly show they have different patterns in metabolic profile with respect to the healthy subject. So I'm trying to move down. Can you see the second slides? Okay, so here you can see this metabolite for control Xu and Si. They have different metabolic concentrations and compound. So they show the diversity in patterns, which of course looks it's not very easy to distinguish what kind of compound are important, what are not important. Here I would like to present a new technology platform, which is a Chinese medicine informatics platform built up by the two Dutch companies, SU Biomedicines and Faculdade. So they combine Western knowledge in drugs, in pharmaceutical activities, ingredient, symptoms, omics data. Most important to combine the clinical data, clinical symptoms, molecular data, and pathways, and integrate with the Chinese herbal pathways. It's called a herbal path. So when we integrate this data into this artificial intelligence systems, what we could obtain the very interesting aspect. So from the Western doctor, they diagnose to have the patient have angina pectoris, and Chinese doctor within the same patient population can segregate them into two subtypes. While these two subtypes made a metabolomics approach, what we can see the data analyzes one subgroup with their highly inflammation, another subgroup, they are having the energy weakness, energy metabolic disorder. So this means the Chinese diagnose with combination of molecular technology, we can generate knowledge as to say what is the scientific evidence in the traditional Chinese medicine diagnose. More important, this information can even help Western doctor when they treat their population of patients, because their population is heterogeneous. With Chinese diagnose, we can segregate into different subtypes. Then we can have also, they have different treatment strategy based on the ancient knowledge. So, of course, once we have a good treatment strategy, good diagnosis principle and treatment strategy, then we are, of course, thinking we need to have a quality. This is also one of my key issues I would like to address for quality standard. So within the European Pharmacopoeia, since 2009, we have established TCM Working Party. And in this TCM Working Party, we elaborate the traditional Chinese herbal medicine monograph to give them quality standard. So to allow them to have a high standard, but also to have a guaranteed safety and efficacy for the patient in Europe. Of course, while we are making these standards, we consider the Chinese pharmacopoeia is one of the bases. So we use Chinese pharmacopoeia information, help us to generate European pharmacopoeia, which is suitable for European pharmacists in pharmacy to do the quality control. So I'm moving to the next slide. So here you can see the next slide is next to the European pharmacopoeia. Within the EU, we have a different pharmacopoeias. Giving example, and German pharmacopoeia and German pharmacist pharmacopoeia, they are all dedicated to medicine, to medications. So since 2009, we also established ISO standard. So why next to all different pharmacopoeias, we still need ISO standard? Because all products from China, not all of them should enter the category of medicine, but some of them in the category of food and food supplement. So there are no guaranteed quality standard for the international trading. For this purpose, here I would like to show an example. So we have different pharmacopoeia. So here I show example, Chinese pharmacopoeia, European pharmacopoeia, India, and USP and British pharmacopoeia. They have all different type of pharmacopoeias. They all aim to guarantee the quality standard for herbal medicine. Here I would like to show example of the curcuma longum. So as you can see, the curcuma longum, we have listed them in Chinese pharmacopoeia, Hong Kong standard, Japanese pharmacopoeia, USP, and European pharmacopoeia. You can see even within the different pharmacopoeias, the curcuma longum have different quality standards. So which in fact require harmonization. For promote international trading, the harmonization of international standard is also important. So here giving example, here is the ISO, what they have done, the harmonization, like the worldwide is a paper size. When we say A4, A2, A3, everybody knows the size. When we have also the credit card, it works in China, it works in Europe and United States. So this is the credit for the ISO, because ISO has built up this international standard to have promote international trading. For this purpose, we think the Chinese herbal medicine is also important to have international standard. As you can see, the electricity plugs, we have no international standard, which also leads when you travel, you have to use different kind of adapters to bring to that countries. So ISO TC249 is the ISO dedicated to the traditional Chinese medicine. This year is extended not only to traditional Chinese medicine, but also to Ayurvedic and yoga medicine, so India's medicine. As you can see here, in the PowerPoint I'm making is 24 active member. So I wrote the PowerPoint was 23, but now it's 24 countries. And we still have 23 observed countries. Within the ISO standard, you can see we have built up 108 international ISO standards and also have different herbs and medical device related with the traditional Chinese medicine. So in the Netherlands, we are also very actively involved in building up ISO standard, which is under the Royal Dutch Standard Committee. So Standard Institute, we build up an ISO standard. For this perspective, we also close work with different European countries, such as we also work together with Portugal, with Professor Olga Silva, because we also have intensive communication for building up international standard. So we have, let's say, systems biology provide evidence for the diagnosis and treatment strategy, we have international standard for the quality, and we also need some research to show the molecular working mechanism. So here is another example. I would like to show the research conducted in my laboratory to show the effect of ginseng. So ginseng, you have different type of saponin, polysaccharide, and phenolic compounds, but it has diverse bioactivities for healing, anti-aging, anti-cancer, antioxidation, and modulation of immunosystems. So with related to the ginseng effect, we have conducted this extensive research to show different type of ginseng in different years. They have different biological effects. Within the diabetes subtype 2, we have also different subtypes. One of the specific subtype is called Qi deficiency with stagnation. This subtype is very suitable for use ginseng for treatment of this subtype of diabetes type 2. So therefore, we have shown the clinical data shows the effect of ginseng extract on treatment of diabetes type 2, but we still would like to know the molecular mechanism of ginseng. So one of the aspects is diabetes 2 is related with inflammation, especially the beta cells, the beta gland cells. When it's due to the inflammation is broken down, it's caused a lot of effect with insulin tolerant, insulin resistance, and also development of diabetes type 2. So for this reason, we try to investigate the molecular working mechanism of the ginseng. So we use the zebrafish because zebrafish has a high gene similarity with human, with 87%, and also is considered in both Europe and United States is alternative animal model system for investigative research. So for the year, we have made extract from white ginseng and red ginseng. Red ginseng is processed ginseng, which has steamed in the rice wine for 9 cycles. And of course, there are still many degradation metabolism happens during the process. So what's very interesting in this research, we have used transgenic zebrafish. And when the zebrafish tail has been cutting down, both the neutrophil, there's a fluorescence labeled neutrophil, and macrophage will migrate to the cutting edge. When you have extract from the white ginseng or red ginseng, they can inhibit the migration of neutrophil. So this indicates they are having the inhibition of the inflammation process. But based on our research study, we have shown that white ginseng looks like much more potent than the red ginseng. Why it looks like? So based on our literature study, we have clearly seen white ginseng has highly concentration in ginsenoside like RG1, RB1, etc. When we specifically take the RG1, when we compare the molecular structure, when you can see on the right side of the pan of the slides, then it looks very much like the basic skeleton of biclometasone. It's a corticosteroid. So for this reason, we have conducted still, we know the corticosteroid has anti-inflammation effect is due to its binding to corticosteroid receptors. So in the zebrafish model, when you look at on the right side, and then the left panel on the right side, we have the zebrafish, which containing glucocorticoid receptors. Then you can see a vehicle, and then after you cutting the tails, the migration of neutrophil to the edge, you can see the biclometasone and RG1, they both has effect in the neutrophil migration. So this is in the background of the zebrafish containing glucocorticoid receptors. But when we use another strain, which is transgenic zebrafish, the corticosteroid has been abolished. And once it's abolished, then it's clearly see the anti-inflammation effect from both biclometasone and RG1 also disappeared. So based on this research result, then we can see RG1 act as selective glucocorticoid receptors against an agonist in our zebrafish model with anti-inflammation effect, but with also no side effect in regeneration. Why it's like this? Please look at the right panel. So the A picture shows the zebrafish without amputation of tails. B picture is when you have amputation, but when you keep the zebrafish still in the egg water, then they can regenerate the tails. C picture is after amputation, you treat them with beclometasone, then this tail cannot be regenerated anymore. While you treat them with RG1, the tail can be regenerated and its effect on anti-inflammation still exists. So this data shows ginsenoside may therefore represent a previously unknown class of selective glucocorticoid receptor agonist, open a novel road towards the development of improvement of anti-inflammation. So this shows not only Chinese medicine can treat patient, we can also use in Chinese medicine as rich sources to study and to find out new compound, new knowledge, which can development of the new product or new medicine for treatment of disease. So for this reason, we think maybe in the past, so we have, let's say, Western medicine may be more dominant to the Eastern medicine, such as traditional Chinese medicine. In the present, both medicine are very much appreciated. And in the future, we hope we could have fusion of Western and Eastern medicine. We generate a we medicine. The we medicine can help the patient for prevent and treatment and also for personalized treatment. That is what at this moment Western medicine are missing. So we could have preventive and personalized medicine. So at the end, I would like to thank you for your attention. But most important, I would like to show one more slide about the GPTCM Research Association. So this is based on the European Framework 7th. In 2012, we built up this research association. At this moment, we have more than 300 members in this research association. We have 7 groups. So we have a pharmacological group, we have a toxicological group, publication, acupuncture, clinic practice, guideline, and regulation and industry. So all these 7 groups, which are very active, we have every year annual meetings to stimulate all old and young scientists work in the field from both China and Europe, especially Europe, to work together. So this year in July, we had an annual meeting in the Kew Garden in UK, and next year we will have our 14th annual meeting in Singapore, in Nanyang Technological University of Singapore. I'm as the president of the GPTCM. I warmly welcome you to participate in this organization and to come to this very interesting conference. I thank you very much for your attention.
Thank you, Professor Wang, for your foundational and thought-provoking presentation, which is of great help to further promoting the standardization of herbal medicine. If you like, we may have some time for 1 or 2 brief questions from the audience. Okay? Any questions from the audience? Oh, okay, maybe if you can share your email, if they have questions, they can send you the questions to your email. Okay?
Yeah, so the email is in my last slides. So do you want me to reshare it?
Okay. Yes, please.
So here is my email address. And if you have any questions, you are all most welcome. And of course, welcome to visit Leiden University. So we had also this year the ISO annual meeting in Amsterdam, so which we received the 40 members from different countries to participate in this conference. Okay, so here is my email address, and of course, I would like to thank Chair for this organize this meeting. Thank you.
Thank you. Thank you once again. Thank you very much. Thank you. So, okay. Before we move on to the next speaker, I have a notice from the organizing committee. Since today's session and the following session don't need any translation, so if you still have the translation device with you, please return to the organizing committee. Thank you.
Okay, goodbye.
Goodbye.
Bye.
Bye. Okay, so anybody have the translation device, please return to the organizing committee. Thank you. Now, let's welcome the second speaker, Professor Huang Liping. She's the Vice Dean of School of Pharmacy, Jiangxi University of Chinese Medicine. Her research interest focuses on neuropharmacology of Chinese medicine. She has led 3 national and provincial Natural Science Foundation projects, participated in national key research programs, and holds 8 patents. She has published over 100 papers, authored or co-authored more than 20 books. Her topic is research on the efficacy and mechanism of traditional medicine for Alzheimer's disease, facing clinical needs. Please welcome Professor Huang. Yeah, please.
Okay. Good afternoon, ladies and gentlemen. It's my great honor to share with my research work, research on the efficiency and the mechanism of traditional Chinese medicine from Alzheimer's disease based on clinical needs. I'm Huang Liping from Jiangxi University of Chinese Medicine. As we all know, AD is a neurodegenerative disorder. It's characterized primarily by progressive cognitive impairments and memory loss. The common pathological features include 4 key components: amyloid disposition, phosphorylated tau tangles, neuron loss, and neuron inflammation. AD has become a global health crisis. Currently, there are over 55 million AD patients worldwide. In China alone, 15.07 million people are living with AD, and this number continues to rise. The disease primarily affects the elderly population. However, the Journal of Alzheimer's Disease reported that the youngest case globally, a 19-year-old patient diagnosed with AD. AD is an age-related disease. In patients, spatial pathological changes occur in the brain 10 to 30 years before cognitive symptoms appear. The Alzheimer's Disease International Commission and the Lancet have published 10 most common warning signs and 12 crucial modifiable risk factors. Research from multiple teams demonstrated that an important finding that a part of AD case can be prevented. There are multiple hypotheses, including amyloid, the tau, the neuron inflammation, and other hypotheses to explain pathogenesis of AD. However, the exact mechanism of this development remains unclear. In reality, the etiology of AD is extremely complex. Current research is somewhat like the parable of the blind man and the elephant. Based on this hypothesis, the main drugs for clinical treatment of AD includes ACHE inhibitors, NMDA receptor antagonists, and A-beta-targeted drugs. However, existing medication can only delay or alleviate the symptoms of AD patients. They cannot completely cure the disease. Moreover, we face a difficult situation with multiple challenges, including concerns about efficiency and safety. In 2025, the AD drug development pipeline shows a significant shift. Beyond drugs targeting the core pathological changes of AD, disease-modifying therapies now account for 76% of clinical trial drugs. Traditional Chinese medicine view the human body as an organic whole. AD is considered the result of breaking this overall balance. In TCM theory, the fundamental cause of AD is kidney deficiency. We name it 肾虚. It's occupied by factors such as phlegm, blood stasis, and toxins. TCM prevents and treats AD through several approaches, including tonifying the kidney, removing blood stasis, resolving spleen, and detoxifying. This has contributed Eastern wisdom to AD prevention and treatment. But to explain clearly and elucidate thoroughly the therapeutic mechanism of this formula and herbs is the key scientific question we currently face. In these days, it is believed that macroglia-mediated neuroinflammation is a key pathological process in AD. When A-beta activates microglia, it triggers a pro-inflammatory cascade. This cascade further exacerbates two critical processes, A-beta disposition and hyperphosphorylation of tau protein. Regulating microglia's function and phenotype represents a promising therapeutic approach. Inhibiting excessive microglia activation and protecting neurons from neuroinflammation may be reliable pathway for AD treatment. They are also potential targets for drug discovery. Seeking effective a new drug from natural products for AD treatment has become a research hotspot in recent years. Several natural compounds show promise. These include tensionol-1, risovatol, and other compounds. These compounds may be potential bioactive components for AD prevention and treatment. Hinospora sinensis, or Kuanjingteng, is a traditional medicinal herb from Tibet region of China. In Tibetan areas, it's traditionally used to prevent and treat aging-related disease and AD. Currently, ultra-fine powder of Hinospora sinensis is available on the market. Studies have shown that this herb possesses multiple pharmacological activities, such as development, improvement of learning and memory, anti-inflammatory properties, and other activities. However, its anti-AD therapeutic mechanism and material basis remain unclear. Through hippocampal injection of A-beta to induce a AD rat model, we found that the ambutyl extract fraction of Pinospora sinensis acquire extract significantly inhibited neuron inflammation. It also reduces A-beta deposition in the brain and inhibits hyperphosphorylation of tau protein. Furthermore, it elevated hippocampal neuron damage and effectively improved learning and memory ability in the modern animals. These findings are consistent with its clinical efficiency. Subsequently, we performed a systematic isolation of the chemical constitution from this fraction. We obtained a lower sesquiterpene glycoside compound, which we named tenosynoside A. We call it TSA. Pharmacokinetic studies revealed that TSA can effectively concentrate to the blood-brain barrier. In vitro cell experiments demonstrated that it possesses significant anti-inflammatory activity and neuroprotective effects. Next, we established a LPS-induced BV2 microglia cell model and conducted a serious evaluation on the anti-inflammatory effects of TSA at this and the cellular level. First, TSA significantly inhibited NO release. It reduced the expression of pro-inflammatory cytokines such as IL-1 beta and IL-6. Moreover, it evaluated the expression levels of anti-inflammatory cytokines such as IL-10 and IL-4. Second, we also discovered that TSA could effectively inhibit LPS-induced BV2 cell activation. It prevented BV2 cells from polarizing toward the M1 pro-inflammatory phenotype. Additionally, it promoted their conversion toward the M2 anti-inflammatory phenotype. TSA also affected the expression of proteins revealed to the tau4 NF-kappa B NLRP3 pathway. This pathway is a key signal pathway for microglia-mediated neuron inflammation. The further clarified the effect TSA on the NLRP3 inflammation, we used the activator nigration and NLRP3 overexpression plasmid, and we found that TSA could effectively reverse the effect induced by both the agonist nigration and overexpression. It reduced NLRP3 activation and evaluated protein level. To clarify whether TSA neuron protective effects are direct or indirect, we established a co-culture system of BV2 and HT22 cell. The conditional medium from TSA pre-treated BV2 cells significantly inhibited apoptosis in HT22 cell. It also increased their cell variability. These findings suggest that TSA may indirectly protect neurons. To determine whether TSA is effective at the animal level, we employed employed APP-PS1 transgenic AD mice and evaluated its effect. The open field test and Morris Watt-Maze test revealed that TCA did not affect the spontaneous locomotor activity of the mice. However, it significantly improved their motor dysfunction. Additionally, it elevated spatial learning and memory impairment. TCA can reduce the number of iNose positive cells in both the hippocampus and the cortex. It also decreased the mRNA level of pro-inflammatory cytokines. Meanwhile, it evaluated the expression of anti-inflammatory cytokines. This result demonstrates that TCA can effectively separate neuroinflammation in AD mice. TCA reduced microglia activation in a dose-dependent manner. It also improved their serial morphology. Furthermore, TCA enhanced the phagocytic capacity of microglia for A-beta. As we all know, A-beta deposition is one of the typical pathological features of AD. It's also a key indicator for evaluating anti-AD drug efficacy. TCA significantly reduced A-beta plaque deposition in the brain of mice. And our result demonstrated that TCA can effectively intervene the aggregation progress of A-beta. This includes its progression from monomers to oligomers and final to fibrils. Using Western blot and tunnel staining, we discovered that TCA significantly inhibits neuronal apoptosis in both the hippocampus and the cortical region of APP-PS1 mouse. TCA also affected the expression of protein related to the tau4 and kappa B and NLRP3 pathway. All these findings are consistent with our in vitro cell experiment results. We have also conducted some exploratory research on effective herbal formula for AD prevention and treatment. Pure was first recorded in Song Dynasty, Shenji Zongnu. It consists of two Chinese medical herbs, Huang Jing and Gouqi. This formula has the efficiency of tonifying the kid and replenishing essence. Clinically, Pure is commonly used to prevent and treat AD and aging-related disease. First, we employed UPLC Q-TOF mass high-resolution mass spectrometry. Combined with the unified data analysis platform, we identified a total of 99 compounds in Pure extracts. In the intestinal absorption solution, we detected 41 chemical compounds. Through oral administration in rat, we found that 7 chemical compounds were present in the plasma. Among these, 4 compounds entered the brain tissue. Next, we established a AD model and used this model to evaluate the therapeutic efficiency of 二进 We found that 二进 improved learning and memory abilities in the model rats. It alleviated pathological damage and maintained hippocampus neuron morphology. Additionally, it reduced A-beta disposition in the brain and inhibited hyperphosphorylation of tau protein. 二进 also exhibit anti-neuroinflammatory effects. These are manifested in several ways. It not only down-regulates tau4, but also inhibits the activation and nuclear translocation of alpha-kappa B. Furthermore, it blocks the activation of NLRP3 inflammasome. This effectively reduces the secretion of inflammatory cytokines such as IL-1 beta and so on. Given that 二进 contains numerous constituents in the intestinal absorption solution, could 二进 improve neuroinflammation and AD by acting on the gut microbiota? Our research finds suggest that 二进 may regulate gut-brain axis and exert its therapeutic efficiency for AD. Thank you sincerely for your attention.
Thank you, Professor Huang, for this deep and compelling insights into the mechanism of TCM for neurodegenerative disease, which is increasingly a threat to people's health and the quality of life. So if audience have a question, you can also email to Professor Huang.
Thanks again.
Thank you very much. Now let's welcome the third speaker, Professor Yang Zifeng. Professor Yang Zifeng is Deputy Director of China-Portugal Artificial Intelligence and Public Health Joint Laboratory, Deputy Director of the Guangzhou Respiratory Health Research Institute, the first affiliated hospital of Guangzhou Medical University, Director of the Department of Disease Control and Prevention, National Center for Respiratory Medicine, Executive Director of Virus Diagnosis and Research Center, National Clinical Research Center for Respiratory Disease, Visiting Professor of Faculty of Chinese Medicine, Macau University of Science and Technology, the member of H7N9 and H5N1 Risk Assessment Team, WHO, Executive Member of the Society of Immunology, the World Federation of Chinese Medicine Societies. And his research interest focuses on the prevention and treatment of respiratory virus infection by integrative medicine. His topic today is treatment for emerging diseases with traditional Chinese medicine. Please welcome Professor Yang.
Good afternoon, amigo. I just learned one word from Portuguese, amigo. Because I'm still in the jet lag, so shall I have your encouraging applause? Thank you. I'm quite sleepy, sorry. Okay, and today it's my honor to be here to share with some my research on our emerging infectious disease by using the TCM. So okay, and also on behalf of my boss, Professor Zhu Nanshan, who is the hero of fighting against SARS and COVID. So today I'm so happy to stand here. And also I have another position working in Macau. So that's why I found Lisbon is quite clean and similar place here. Okay. And first of all, I would like to talk a little bit about how we understand the key characteristic of emerging infectious disease. And I think basically there are three characteristics in their in emergent infectious diseases, not only in the Western countries or as well as in the Eastern countries. So first is the high transmissibility. So that's why we have to think about whether we can use some agent to prevent apart from the vaccine. The second is the sustained outbreaks. As we know, this disease do not fade away quickly, and instead they tend to have a prolonged outbreak periods. Number three is characteristic is the lack of efficient prevention and control measures in the early stage. Even in China, during the early stage, we are unable to have the very powerful tool to prevent the infectious disease. So, so this is very interesting. I just summarized some Chinese experience in fighting against infectious disease. For example, in 1954, TCM therapy has shown works well, result in the treatment of the Japanese encephalitis. And when SARS broke out in 2003, the remarkable effectiveness of TCM treatment was widely recognized. For example, one very important publication in the American Internal Journal, Internal Medicine. Many patients benefit from TCM intervention, which help relieve symptoms, reduce the progression to the severe cases, and improve the overall treatment effect. And TCM also play a very significant role in avian influenza, which long ago we recognized is the Asian disease. However, in 2024, there are the first lethal case in America because of the cow infected with the H5N1. So anyway, the integrated approach of traditional medicine and Chinese medicine and Western medicine aim to forge innovative theories and methods for effective integration. So on one hand, involve the fusion of the histolytic subjective fusion prevention of TCM and the targeted objective meticulous analysis of Western medicine, as mentioned in the morning by my boss, Professor Zhou. And TCM looks at the human body as a whole. Actually, I serve as the Western medicine doctor in China. However, I also recognize this point. So human body is a whole. Consider the balance of various systems. While Western medicine focuses on some specific organs, cells, as well as molecules. Combining these two perspectives allows for a more comprehensive understanding of disease. It's quite helpful for my experience. So later I will show you some example. On the other hand, it combines syndrome differentiation by TCM and disease diagnosis by Western medicine is quite important. We have to diagnose accurately, precisely. On this integrated approach of traditional medicine and Western medicine to forge innovative various methods of effective integration. Anyway, I think so we have to think more and more about the histolytic theory on this field. And this combination enable more accurate diagnosis and personalized treatment plans. This is my thinking and understanding after several years. Anyway, so this is more complicated. I try because I am a Western medicine doctor. I just say that. I think this is quite in depth about the TCM histolytic syndrome. So first is treatment according syndrome differentiation. Each patient's condition is unique. And so TCM practitioners tailor treatment plans to individual syndrome, ensuring personalized care. The second is the use of a multiple component, multiple targets. As my colleagues from China talked earlier, I think the multiple components, multiple targets, and multiple pathways is a very important thinking way for TCM. However, let me know, and let everybody know what component, what are the components, what are the targets, what are the pathways. It's a long way to go. But we are confident to step by step to make it clear. And this is, I think, very, very complicated, but I just let you know more. This is, I think, the dominating Chinese scientist thinking in the in recent years. So number 3 is very important, is adaptation, a historical, a global perspective. We should be open to work together, to understand. Otherwise, we are unable to say how to integrate Western and Chinese TCM together. Okay. Okay. And although I so very powerful, but frankly, to be honest, I think nowadays there are still some bottlenecks. For example, I work on the infectious disease. How can we find out a very accurate or suitable animal model is very important. As we know, if we would just adopt the Western animal model directly into TCM analyze, it's not very suitable. This is my thinking. And secondly, I think we still lack of the very cutting edge of technology for the study of the mechanism of action. So that's why now we make use of a lot of analyzed system. For example, the TC mass spectrum, something like that. The number 3 is about the ambiguous integration mechanism, because we go back to the beginning. We hope to study the TCM by using the historical thinking way. So it's very important. So that's why nowadays AI is more and more popular and more powerful. I think so. This is, I think, this is the bottleneck, not only for us. I think also for the understanding for the global scientists. Okay, so after that, so I would like to talk about my approach. So first, because we have going to overcome this bottleneck. So first, we setting up the substance basics and target confirmation by different methods, including the ranging from the cell line. Even recently, we also established the organoid system, as well as the animal model, even the primate animal model, not only the mice model. And secondly, we also have the very good integration system. I think it's quite clinical thinking, like MDT. I mean, multidisciplinary system. So we work together, we discuss together, so that we can make a more comprehensive decision approach. So, for example, I just show in the last 20 years, I already established more than I think more than 20 animal models. For example, for influenza, previously we just make use of the mice model infected with influenza. However, it's quite quickly to become the pneumonia. So we tend to introduce the ferret model, very interesting animal. Because it can cause the fever, and as it is in the cause, even they have showed the causing but anyway, it's like a human cause, quite different from the mice. So, and for the respiratory RSV virus, which very common is common seen in the pediatric patient, we use the contact rats and so on. But more recently, we also developed a very interesting mice model by transferring the ACE2 receptor, human resources receptor, so it can show the intestine as well as the respiratory symptoms. So that we can make use of this Western medicine animal model into evaluation of our TCM. It's quite becoming more powerful. So, and also in our lab, we also have the more than 50 different viral isolates. I think it's quite powerful, even in Asia, even in the world. So because we have also a very huge biosafety level 3 left. So, and after that, organoid, nowadays it become more and more powerful because I think, you know, human and animal, how we can find out a very good transmissible agent, I think the organoid is very powerful. In this organoid, nowadays we can observe lots of different parameters, much powerful than the cell line. Okay, so for the substance, we because I have a lot collaboration with Macau, including Macau University as well as Macau University of Science Technology, Professor Jiang Zhihong. He gave us a lot of support on the analyzing system, so that we can find out the very potent component from TCM. Okay, for the summary one, I don't want to talk too much. I just say, so, and how to integrate the Western and Chinese medicine together, I think very important. We have to absorb the international and modern technology system. And also think about the histological thinking way into this system so that maybe we can find a very good new ideas. Okay, so here I would like to say, because we are the very top Western medicine hospital in China, even that we also very interested in the different very famous classic formula Chinese medicine. For example, Balangen, Lianhua Qingwen capsule, and Yupingfen granule. I will talk several stories here. So, and before that, I would like to say again, I have a long collaboration with Macau. So I think that's why I quite feel excited to be Lisbon. Okay. Okay, and after several years, we already, I think for the representative work, I think basically there are, I think 5 representative work I would like to say. The first is single drug. I would talk about the Balangen. For the new formula, I would like to talk about a little bit about the Lianhua Qingwen capsule. And finally, some confidential formula. It's very interesting. In China, there are some we are unable to take out its a formula. So it's a confidential formula. Number 4 is very easy to be accessible. It's a classic formula. For example, the Yupingfen, and some even the single compound. So I will say several story. Okay, and for example, this is the we call it Balangen. So it's a very interesting and also widely used in southern China, and also widely used in the overseas Chinese. So I will be interested to look at whether we can find it in the Chinese supermarket in Portugal. When I was in USA, I always find it. So and this is very interesting. So in this research, pharmaceutical substance basics and target confirmation is very important. So we conducted in-depth study focusing on the detoxifying TCM. So what's the meaning of detoxifying? I think is one is anti-bacterial, another one is its efficacy anti-viral. For example, influenza. So we constructed full component library of the Esteris root. This library includes all the chemical components present in synthetic fluid, which provides a comprehensive material basis for studying its active components. On this basis, we carry out target confirmation and the lead compound discovery. And this active component are potential lead compounds for development new drugs. Actually, we developed one from this basis. And we also optimized the lead compounds based on the target structure. By analyzing the structure of target proteins, such as the viral protein for the host protein involved with the infection process, we modify the structure and to the lead compound to improve their binding affinity to the target. So in this research or integration mechanism, we clarify the interaction between the active component of TCM and the target. So, and this paper, very lucky, we published in the Science Supplementary about 10 years ago. So we talk about the Banangen story. So I worked together with the Professor Liu Liang, and recently we are happy to say that this is product has been approved by the Macau government. I think this is a little bit different from the mainland China domestic FDA. So I think because we can make some improvement inside this product, it's quite interesting. Okay, so and this is a tactics. Oh, yeah. Sorry. Okay. Probably, I'm so sorry. Probably the slide stop here because. Okay. Okay. Leave me one chance. Next year, I told you the story next year in Lisbon, okay? But I think that I just talk here. I let you for Lianhua Qingwen capsule. We conducted 3 RCT clinical trials, so very, very difficult. And also one clinical trial was conducted in the South Asian countries. So proving that this product can be used in the prevention and the treatment of the influenza as well as COVID-19. Hopefully, we can work together with our Lisbon peer colleagues together in coming future. Anyway, and finally, I would like to acknowledge to my boss, Professor Zhong Nanshan, as well as my colleagues in the clinical department, as well as our basic research department, as well as our international work department. Anyway, many thanks and appreciated, mostly appreciated for the organizer from China and Portugal. My good friend, my very good friend, Professor Zhu, for deputy, and everyone. Hey, so sorry. Okay, wait for me next time in Lisbon. Thank you very much.
Thank you, Professor Yang. And any questions? Any questions for Professor Yang? Any questions?
抱歉，漏了好多张。
Okay, okay. Once again, the notice and still there are 2 translation devices missing. So if you still have the translation devices, please do return to the organizing committee. Thank you very much. Thank you, Professor Yang. And now it's time for coffee break. Yes, still missing. Oh, that's great. All right. I have all the introduction of the speakers. Maybe that's for tomorrow.